So we've been tracking the rise of coronavirus cases in the United States, and we started seeing the numbers spike on June 19th. There was the idea in late April, early May, that that was the peak when we had 30,000 new cases a day in April, May. We were hoping, I guess, I mean, I certainly was hoping that we were past the peak, at least the wave one peak. And it looked like maybe we were until June 19th, when we started seeing cases climb and climb and climb, up to as many as 60,000 new cases a day a few days ago, centered around California and a bunch of red states, including Arizona, Florida, and Texas, at the top of that list. And what we observed for the last 20 or so days was that even though the cases were spiking, the deaths were staying pretty low. And you can see if you're looking at the chart of deaths, they've been trending down. And all along, there were questions about how is this possible? What's going on? Now, the most obvious explanation, maybe we would call it the simplest explanation, we could say the explanation that requires the fewest assumptions, is that there's simply a lag between cases and deaths. You don't die the day you're diagnosed. So when you see cases spike, you would expect that it would take some time before those increased case numbers turn into deaths. There were other explanations that we considered as well. Is it possible that the virus has mutated to be less deadly? It's possible. We didn't have any evidence for it. Is it possible that doctors are getting better at treating coronavirus patients, which is decreasing the death rate? Certainly possible. Could it be that more testing means healthier people are getting tested? So even though you have more cases, the share of cases that are serious could be declining, and that's why the deaths continue to trend down? Or is it younger people getting coronavirus who are less likely to get really sick? All of these are reasonable possibilities to wonder about. But if the explanation is the first one, which is there's a lag between cases and deaths, we would expect that somewhere in the range of 18 to 21 days after the cases spike, deaths would start to spike. 18 to 21 days from the start of the case spike is this week. It's yesterday. It's today. It's tomorrow. And sadly, tragically, yesterday, Arizona and Texas both hit single-day death records dating all the way back to the start of the pandemic. Yesterday, we had, again, nearly 60,000 new cases of coronavirus reported, and deaths in Arizona and Texas. And by the way, also in California. California is not exempt from this, but it's been mostly the red staters saying that it's Arizona and Texas that weren't going to see the death spike. They are spiking. Arizona with 117 deaths yesterday. Texas with 84 deaths yesterday. Those are sad. These are not records we want to be setting. These are tragic new high marks for coronavirus deaths in a single day. Now, I don't want to be alarmist, and I hope that I'm wrong, and I believe that I've been relatively sober in my analysis of coronavirus from the start. The simplest explanation is that the deaths are spiking because the cases spiked 20 days ago. And if that's the case, in another 10 days, the death numbers are going to look really, really bad. And what I mean by that is cases started to spike on June 19th. So the small spike in deaths we're seeing now would be related to the start of the spike in cases on June 19th. Around July 1st, the new case numbers were dramatically higher than on June 19th. And if that tracks as a leading indicator to eventual deaths, in another 10 or 15 days, we are going to have unconscionable numbers coming out of some of these states. It's horrible when we're right about terrible things. And this is really, really terrible. Now, if we want to find something to look at that looks okay, there are still some states doing quite well. Right now, the states with the lowest reproduction rate of the virus are Connecticut, Washington, D.C., which is not a state, Maine, New Hampshire, Massachusetts, Rhode Island, Maryland, and Utah. Although the reproduction rate there, what's called the R naught or the R0, it's starting to creep up. And what I believe is going on is nothing that requires any kind of particular insight. The states that are doing well can only hold off cases for so long if other states are a disaster, because travel between states is constitutionally, it's a constitutional right in the United States, ingress and egress from and to states. And when you look at the county level map of the United States and you see, the red and orange counties, the ones that are in trouble, they're right next to counties that are doing far better. And so I believe that, sadly, unless there are some interstate travel restrictions put in place, which I'm neither recommending nor do I believe would necessarily be legal, I'm merely making a sort of mathematical statement, you're going to see some of the states that are doing well start to do less well if cases continue to skyrocket in places like Florida, Arizona, California, Texas, and many others. I can't even give you the full list. Now, I do think also that there are some governors, including our governor here. I believe Charlie Baker here in Massachusetts has widely done a very good job. And what I'm worried about is they're now doing the indoor dining in Massachusetts. I got a message from my gym that it's opening next Monday. I think that this is a mistake. We've done so much work here for the last 4 months to get down to only having a couple hundred new cases a day without a spike. It's like every day about 200 cases, 200 cases. It seems to me, given that it's summer, given that people can do outdoor dining, given that people can do outdoor workouts, I understand the business side of it. It seems too risky to me to do indoor dining or to open gyms, movie theaters, and some of the other things being discussed. I won't be partaking. I've been doing the outdoor dining. It feels safe. It's more than enough. It's warm out. I think that that's a risk for the states that are doing well to do right now. And I hope that I'm wrong, but the numbers are truly, truly scary.